My name is Peter Muindi Kilungu. I live in Sabaki in Athi River.
My name is Ndunge Muindi. I started a bit far because I didn't know what to do with myself because I had the pain. My knee was swollen, painful. I started moving with a stick for a longer time. I went to consult some doctors. There are some Indians who come in Kenya to help people about it. I went to women's hospital, and there they told me I need surgery, and it was a bit difficult because the money they talked about we could not afford, because they did about $1 million shillings to go to India. But when we were there, we thought of second opinion. So we went to Kijabe, and there it is where we met an administrator, was a Muzungu, and as we share with them after we have seen a doctor, he asked us where we are coming from. Then he told us because also the money we were asked there, we could not afford. So we talked to the Muzungu, and he asked us which part of Kenya we are coming from. And we told him we are coming from Machakos, by then it's district or province. So he went through the papers. He told us there's a doctor who has moved to Machakos. We have started at the branch at Machakos. So he looked at the pages and he gave us a name, Dr. Nguku, with his telephone number. So he told us, before we go there, we can consult Dr. Nguku. And that is why he led us here. So by then he was not working from this hospital. He had a branch somewhere. So we went up, I saw him. I brought all the pictures, x-rays to him. So he came and checked my leg, and my leg was swollen. The pain was too much. So the other thing was, they are considering I'm at the age. Yeah. By then I was 68. So I was fearing because of the age. Okay. But he told me with the age, unless I have other complications, I can go through the surgery.
Okay. So this was a knee replacement surgery?
Yes. This is already operated. So he asked us whether we pay the NHIF. Yes. We told him I am being a teacher, so I've been paying when I was in school teaching, and still I did not stop, I continued. So he told I have a better chance to get the money from the NHIF. So my husband went to check, he was direct what to do. Yeah. He went to NHIF. The money they wanted by then was $350, and the NHIF had given us $250. So my husband went back again to the NHIF, and they told both of us, we are missionaries in Kenya. We work for Child Evangelism Fellowship, and this is a faith ministry. We do not have any cash that is flowing, but we can get support from churches, from friends. So we told them we cannot afford the 100,000 to add on. So when he went back, he checked that we added the 100,000, so it became 350. So when we came back, Dr. Chris from Shalom, he said that is enough for everything. So what we are left with is just the money for physio to maintain the pain. That is what they did not pay for us. But the operation, everything was done through NHIF, and I'm so thankful to that organization. I'm healed.
You can even see it.
How was the healing process for you? How long did it take?
Mine was a bit faster.
Yeah.
The way doctor recommended. because he told me I was healing faster than many ages he has seen.
Yes.
So it was very fast. For the 2 weeks, I was walking without crutches. Yeah, and I didn't have complications. The cut was clean, and it healed. And when God went back to work.
Okay,
Yeah.
and you were in your 60s then?
By then I was 68, I think 68. Because now I'm 66, or because today I am, by 23rd this month I will be 71.
Oh, happy birthday, Mama.
The knee replacement is good, especially for the elder people, because it becomes, we have been working hard. This age, we used to do so much for the family, so that we may make our family look better, do better. So mostly we used to walk for longer periods. We didn't have cars, and let me see, my husband used to have, but we worked in different directions. So he will drop me there, but later I will move. So you find we have a lot to do. So what I can encourage other people, knee replacement is good, because like myself, by then I could not walk for long distances. I could not do a lot of the work in the house. But now I can bend. I still work. I'm working for Child Evangelist Fellowship, and sometimes I walk to the place, I come back. So it is good, because in a way it adds us a new life. It encourages us to do more in our age than what without, because many people are fearing. The fear and those myth. Ukiwa nafanywa hivyo, wewe ni mzee, haiwezekani, because that is what naulizwa, walikuwa unataka kwenda wapi na hiyo miguu? Unaona, such a question, it is discouragement. But I told them I have to go, because the pain, I used to tell them, I see God adding me more years. So I cannot stay with that pain until those years God will give me. So when I came, it was easier, it was put. I walked, people could not believe. I was walking, shoes, they call me shoes. Shoes, how are you feeling? So it became something to talk about within the court where I'm staying. When I went home without now the stick, I just use sometimes stick because of the stiffness of the areas, just to support me to go. But I'm okay, I can walk, I can go and do my things in the home. So it is good, someone to hope to go for it. Because they should stop about hearing this and this, do it for yourself.
Well, come here today for a follow-up of a surgery that was done by Dr. Nguku and his team on the 9th of February.
That should be 10 days.
Just 2 weeks ago. Yes. Then I was given to attend sessions of physiotherapy, and therefore today I've come for physiotherapy and a further instruction on how to continue with the treatment. So the physio is going on well, but mine has also healed as quick as Rosie's. So that is how it is, and therefore we trust that we are doing well. This is a 1 week progress.
This is very impressive.
It's less than 2 weeks anyway. It's more than 1 week. Well, usually we discuss with my wife, and when I thought I should come to see Dr. Nguku, he had told me that I can continue to be treated by medicine. And then last December, he said that was the end of the medicine. We cannot use medicine anymore. And therefore, we agreed in the new year, we shall do the surgery. According to Dr. Nguku, it costs 300,000, and all that was paid through the NHIF and we got to the hospital at Jumuiya SEK Hospital, Nairobi, and we did the work. But for the physio, I've been coming here.
I'm certified because I'm okay. I can walk, I can do a few things at the home. So I can encourage others too, those who are elderly like me, to come and get the help. And the other thing I can encourage is to tell elderly people, the children, our children, to pay for us NHIF, because it also has outpatient. Small things, we can go, we get medical attention freely. So it is a good thing.
Personally, I'm 77 years already. And my colleagues of about that age, they were discouraging me to come. And some of them have started to come with me and they backed off. So I wanted to encourage those others out there that they can get good treatment and they can recover. Because even myself, I got to a point where I was thinking that the healing may not happen, and therefore I will be left with a wound for a long time or other complications. But you can see the healing has healed clean. So I'm grateful for the services in this orthopedic clinic.
To enroll their parents to the NHIF so that they don't give a lot of money, because at this age we get sickly just often. So if they can pay for their parents, it will be easier for them to go to NHIF, because the NHIF has inpatient and outpatient. So small things like colds, like what, we go to the clinic, we get it, we go back to home. And I'm sure, it was not done for me, I wouldn't be the same I am. But it has gave me strength, I can eat, I can walk. I would encourage other people to come and get good and clear treatment here, and cheaper within this orthopedic clinic at Machakos. It has good staff. Those who are doing the physio, we went physio thoroughly well. We get medicine here, they have advanced, they can say so, because last year it wasn't like that. They have advanced this year. They have now physio here. We have now pharmacy here, so we don't have to walk over and again. So we recommend people to come to Machakos Orthopaedic Clinic.